Welcome to this presentation on collaborative clinical pathways. Darling Downs South West Queensland Medicare Local is wanting to develop local pathways using the map development tool Map of Medicine. Darling Downs South West Queensland Medicare Local covers 400,000 square kilometres and includes almost 300,000 people, 50% of whom live in low socioeconomic disadvantage. We want this to be a joint partnership between Darling Downs Hospital and Health Service and South West Hospital and Health Service, so we can cover the entire patient experience from general practice to primary care, through to acute presentations and admissions into secondary care. The aim is to enhance collaboration and integration across the region. This short presentation will provide a background behind collaborative clinical pathways and Map of Medicine, and it covers some of the key features for the development of pathways locally. Clinical pathways have been in use since the early 1980s, and a number of studies have demonstrated the benefits. A study in 1995 showed that approximately 60 to 80% of patient conditions in general hospitals would be suitable for pathway use. While using collaborative clinical pathways has a number of benefits for health professionals, including evidence-based best practice, one of the key areas where benefits have been immense and exceeded expectations overseas has been collaboration. This collaboration has been between health professionals across primary and secondary care, as well as across local community services, NGOs, and other health professionals. In developing maps, health professionals get together and design the local maps collectively. They select what evidence is currently being used and develop consistent referral criteria so that patients can be seen when referred. All too often, a GP will send a referral form only to find it bounces back because the referral does not meet criteria. Ultimately, the patient's care is improved through seamless care and enhanced awareness of services available. So, collaborative pathways are an amalgam between evidence-based best practice, clinically driven, clinically led local pathways, with always the patient at the centre. In New Zealand in 2010, the National Health IT Board funded a review of 14 clinical pathway toolsets, including Map of Medicine. The aim of the study was to select a common preferred pathway tool that could be used by all 20 district health boards within New Zealand. Unfortunately, district health boards chose to adopt their own preferred tool, and a national tool did not eventuate. However, findings from the National IT Board evaluation showed that Map of Medicine was the preferred clinical tool and scored highest of the tools evaluated in the review. Here is a map of New Zealand. As you can see, all district health boards within New Zealand are using one of three pathway tools. In the South Island, DHBs are using Canterbury pathways or health pathways. In the Central North Island, DHBs have chosen to go with Map of Medicine. And in the Auckland and Northland region, a local pathway tool is used. As far as Australia goes, Map of Medicine has been successfully introduced into Queensland within Metro North Brisbane. Like our region, their pathway tool project is a joint effort between Medicare Local and the HHS. Other parts of Australia, including Melbourne, are also looking at picking up Map of Medicine in the near future. So what is Map of Medicine? Map of Medicine is a UK-based software tool used by the entire NHS. It houses a collection of approximately 400 clinical pathways based on existing evidence and international guidelines. But in addition, there are over 1,500 localised pathways. What this means is that any time a new map is developed locally, anyone with Map of Medicine can view it. They can share the map and get ideas to develop local maps within their region as well. For example, in Palmerston North, New Zealand, we developed a behaviour issues in children map. This was because GPs had expressed concerns that they did not know what to do with children with behaviour issues that were not severe enough to be referred to acute hospital services, but were too mild to be sent away with nothing. We ended up working with a multi-sectorial team of child health experts and experts from across social services and schools to develop a comprehensive map that outlined a variety of local services available. The map was not a clinical map, it was more a map of local services. And although the services had always existed, no one had known about all of them until the map collated them and presented them in one easy-to-find location. Since then, the map has been published on Map of Medicine, and Metro North Brisbane, who saw the map, have also used the same map as a concept to develop their own local behaviour issues in children map. Another great thing about Map of Medicine, as explained already, is its focus on communication and collaboration. It's also a good memory aid for rare conditions, and it's very useful for new GPs within an area to know what services are available. The following shows the reference list for a clinical collaborative pathway. This is based on a chronic kidney disease map developed locally in Palmerston North, New Zealand. What the reference list shows is that there's a mixture of local evidence-based best practice guidelines, national guidelines, as well as international guidelines. The choice of which references to include is up to the discretion of the working group. Therefore, for this pathway, the local group that felt that it was important to include a local pathway developed and used within Palmerston North, as well as using Kidney Health New Zealand guidelines and NICE guidelines from the UK. We hope to improve patient outcomes through standardised care and referral processes, but we also want to improve health literacy. What we hope to do with our locally developed clinical pathways is have a corresponding patient version. This would include key information from the clinical version, but set up in an easier to understand way. It would include links to key best practice patient handouts, so patients don't have to search the internet to learn about their condition and get the wrong information. The information on the patient map would be reliable, evidence-based, and ensure that there is better adherence to self-management guidelines, material, and advice. The following is a list of stakeholders who were involved in the development of a Constipation for Children map for Palmerston North, New Zealand. As you can see, there's a mix of primary and secondary care health professionals involved. Within the hospital, we had a paediatrician and a clinical director of child health, but we also had a clinical nurse specialist from within the hospital. Within the community, there was a nurse practitioner for general practice, a GP, as well as a community clinical nurse specialist and a pharmacy. Each map would require a different level of professionals on the group. For example, for child health, this would be a common mix of primary and secondary health professionals. However, a mental health map might include more use of NGO professionals, secondary care and primary care. Once a map's developed, it then goes out for wider feedback for around 3 weeks. This could include all stakeholders within the community. When the Constipation and Pathway for Children map went out, we received additional feedback, which is explained now. These were the other people that read the map and realised actually you've forgotten pieces of information, and they provided a valuable additional information. For example, the local university wanted their clinical psychology service mentioned within the map, as they assist children who have severe phobia of going to the toilet. In addition, the public health nurses wanted their details added, as they feel that they had a big role to play with constipation for children who would go to school. So we're now going to look at a Map of Medicine demonstration and how it actually works in practice. But as Henry Ford once said, coming together is a beginning, keeping together is progress, working together is success. And from my experience, this has been what Map of Medicine's been able to achieve much greater collaboration between health professionals, and a really good shared common goal and purpose.
Welcome to the Map of Medicine tutorial video using the Map of Medicine. This video will explain how to get the most out of the Map of Medicine site, including the new features. Note that Map of Medicine is compatible with most browsers from Internet Explorer 6, but works best in Internet Explorer 9, Google Chrome, Safari, and Mozilla Firefox. When you log into the Map of Medicine, you'll first land on the home page in your default view. This is usually based on the organisation or area you work in. A view contains a collection of care pathways, a mix of those published nationally, regionally and locally. Locally published care pathways can be distinguished by this icon, but only if they're available in your area. This browser tool shows the care pathways that are available in your view, organised by increasingly specific subject areas. In addition, you can use the Care Map A to Z and Find a Care Map tools to browse the list of care pathways in different ways. If you're looking for something specific, you can search here. If you search for example, abdominal pain, you can browse matching results from your current view, the international view, and other local views. When you click through to a care pathway, you can see the overall flow of the patient journey immediately. Care points are colour-coded, green for primary care and blue for secondary care. Where you see the eye icon, you can click for more information on that point. The R icon indicates a referral, and the arrows show a link to a related pathway. You can also access other pages in the pathway, if applicable, using this button. You can bookmark a page to review later, or if you're likely to return to it often. If you want to use it offline, print a PDF of the page. You can also make a note on a care point like this. You can also find out more about the pathway. When was it last updated? How long is it expected to be valid for? And which local health community developed it, if appropriate. The provenance certificate may provide more detailed information. For many pathways, there are alternative versions created by other health communities, which you can view using this button. Whenever you're viewing a care map, you can access all the navigational tools available on the home page, including seeing all local care maps in the current view. Many clinical users of the Map of Medicine find it particularly useful for recording their professional development activity for revalidation and appraisal. For a record of all pathways you visited, as well as any notes you've made, request your Professional Development Certificate here. You'll get a PDF certificate which includes any notes you've made and provides more information on how to include it in your portfolio. If you need any help using the Map of Medicine at any time, you can access the help files here or provide feedback on your experience with the site here.
That concludes this presentation. For more information, please feel free to contact me at sgardner@ddswqmedicarelocal.com.au. Thank you.